Let's go, girls.
Understanding the Menstrual Cycle by Shauna Mornings. Is this what you look like when someone mentions the words menstrual cycle? Not only is it exhausting to have, it's also exhausting to understand. Let's start by talking about the phases of the menstrual cycle. The first phase is the follicular phase, also known as the proliferative phase. The second phase is ovulation. And the third phase is known as the luteal phase, or the secretory phase. So how long does a normal menstrual cycle last? Well, according to the Academy of Pediatrics, a normal cycle ranges anywhere from 21 to 34 days. The follicular phase is the first phase that starts the cycle. It starts on the very first day of menstrual bleeding, even if it is just spotting, and lasts from day 1 to 13. Many do not realize, but the brain plays a huge part in this phase. The hypothalamus creates gonadotropin-releasing hormones. These hormones are transported through tiny blood vessels to the anterior pituitary gland. This gland uses the gonadotropin-releasing hormone to produce follicular stimulating hormone, FSH, and luteinizing hormone, LH. So what do these hormones do? Well, FSH is used to start developing the follicle, hence the name follicular stimulating hormone. So why do we need to stimulate a follicle? Well, that's because the follicle is where the female egg resides. So this image does an awesome job showing you what is going on between the brain up in the right and the ovary down in the left. So both FSH and LH travel in the bloodstream and bind to receptors in the ovaries to produce estrogen and progesterone. So as you can tell that during the first part of this follicular phase that both estrogen and progesterone are low. Now here's where it gets tricky. Estrogen is stimulated by both FSH and LH. However, LH production is inhibited if estrogen concentrations are low, which this is called negative feedback. You can think of this process as the same as predators and prey within a population. If the number of prey, which is estrogen, decreases, then it's likely that the predators, which is LH, will also decrease due to starvation. So what's the deal with this vaginal bleeding, also known as menstruation? Well, it happens usually between days 1 and 6 of the cycle and can vary in length and flow depending on the woman. Bleeding occurs due to the shedding of the uterine lining, which is also known as the endometrium. At the beginning and during this shedding process, tiny little lipid hormones that promote inflammation, known as prostaglandins, are formed. These prostaglandins are what cause females to cramp due to the constriction of blood vessels in the uterus. If they get into the bloodstream, they can also cause nausea, vomiting, diarrhea, and headache. According to the Physicians' Committees for Responsible Medicine, non-steroidal anti-inflammatory drugs, also known as NSAIDs, such as ibuprofen or Aleve, can decrease the prostaglandins, which is why they are first-line treatments of relief of menstrual discomforts. By approximately day 7 of the menstrual cycle, one of hundreds of follicles within an ovary will be selected and referred to as the primary or dominant follicle. So on day 11, primary follicle has matured to its fullest and FSH levels have declined. Also at this time, estrogen levels slowly begin to rise and LH levels spike, known as LH surge. This happens to prepare the ovary to release the mature egg, also known as ovulation. Ovulation usually occurs around day 14 of the cycle. What happens is the egg starts to travel down the fallopian tube and into the uterus. Also during this time, the corpus luteum is formed within the ovary from the follicular wall cells. The corpus luteum is an important part of the remaining days of the cycle because it has tremendous influence on the production of progesterone levels, as well as estrogen, but not quite as much. The luteal phase always occurs after ovulation, no matter what. This phase usually occurs for 12 to 15 days. If implantation does not occur, LH levels will then begin to decline. The corpus luteum will start to break down and progesterone levels will decrease. The breakdown of the corpus luteum usually takes about 10 days and then stops producing progesterone. The luteal phase ends right before the beginning of the next menstrual cycle. I hope this video has helped you understand what is going on within the female body during the menstrual cycle.
It's human nature. Why